On the day of your surgery, please plan to arrive at same-day surgery at your scheduled time. The time you were given will be earlier than your surgery time in order to give the RN team time to prepare you for your surgery. Be sure to bring a coach along with you. It's important to have someone else lend support, ask questions, and be there for you. Ideally, this coach will provide assistance after your surgery and during your recovery period. When you first arrive at CMMC, enter through 60 High Street, proceed down the long corridor into the Memorial Wing, take the elevator up to the second floor, turn right off the elevator, and same-day surgery will be the first left. You will be asked to change into a warming gown. A pre-op nurse team will complete a full assessment including vital signs and will start an IV. For this initial assessment, your coach will be asked to wait in the waiting room until you are changed and the nurses have finished their assessment. They are more than welcome to join you directly after. Once your surgeon is ready for you in the operating room, you will be transported to the holding room. At this point, your coach will wait for you back in the same-day surgery waiting room. The surgeon will call your coach after completing the surgery. There will be a wait time of approximately 1 to 2 hours before you're brought back into your room at the Orthopedic Institute. Once you're settled, we'll give your coach a call and have them come to your room.
This is the area where the final preparation and safety checks are conducted prior to heading to your operating room. A major portion of this will be meeting your anesthesia team. The anesthesia team will consist of an anesthesiologist and a certified registered nurse anesthetist. Your anesthesiologist is a physician specially trained in anesthesiology and perioperative care. The anesthesiologist will assess all of your medical information and ask you several questions pertaining to your medical history and current state of health. This is part of the final checklist to ensure that you are optimally prepared for surgery and to help guide us in our final anesthetic plan. Once this is completed and a final check of the room and materials have been completed, you will be taken to your operating room.
Once you're in the operating room, you'll be greeted by the rest of your surgical team. You'll be asked to move over to the operating room bed. Your nurse anesthetist will be placing monitors on you while your nurse will be making you comfortable on the bed. You will then be given medication to induce anesthesia. You'll be monitored throughout your surgical procedure. You are in the very best hands at the OICM. Once your procedure is complete, you will then be monitored in the recovery room.
This animation of hip joint replacement depicts an arthritic hip with the muscles and tendons removed. During hip replacement surgery, the cup or acetabulum is replaced with a metal insert with a plastic implant. On the femoral or leg side, a metal implant is also inserted with a femoral head attached. These two pieces of hip joint join together to form a pain-free hip joint with full range of motion.
When your surgery is finished, you will go directly to the recovery room. The recovery room is also called the Post-Anesthesia Care Unit, or PACU. In the recovery room, you will wake up from your anesthesia. You will have a registered nurse caring for you while in recovery. Your nurse will make sure that you are warm, receive appropriate pain medication to help manage any discomfort that you have. When you are awake, warm, comfortable, and your vital signs are stable, you will be transferred to your private room on M2. You'll see that we've made every effort to make your room as home-like and welcoming as possible, including seating for visiting family and friends. We will let your coach know where you will be going.
After your surgery and a rest period, we will help you get up and walk. We will of course assist you so you cannot fall. We'll help you get out of bed, we'll use assistive devices such as a walker, and we'll assess your ability to bear weight. You can expect to do exercises with one or more of our certified physical therapists. Please bring in loose, comfortable gym-type clothes and footwear to use with your therapy sessions during your stay with us. You will learn how to walk with a walker or crutches, and you will learn how to do stairs. Your therapist will have an exercise program for you to continue on your own at the hospital and at home.
You will be visited by your occupational therapist on post-op day 1 or 2, depending on how your recovery is progressing. the occupational therapist will be meeting with you to review your total hip precautions and talk to you about how you will perform your daily activities such as bathing and dressing and toileting while maintaining those precautions. The OT will be bringing in tools, which are called adaptive equipment. They will show you how to use this equipment to wash and dress yourself without bending, crossing your legs, or turning inward. Please bring in loose, comfortable clothing and footwear to use with your therapist during your stay with us. The therapist will also talk to you about your bathroom. They will want to know how your home bathroom is set up and will discuss options for bathroom equipment with you. It's helpful for you to check before you come into the OICM to find out ahead of time from your insurance carrier what, if any, bathroom equipment is covered under your particular policy. The therapist will review your home setup with you also. We strongly encourage you to prepare ahead of time by making sure you have attended to basic safety issues such as having night lights installed, eliminating scatter rugs, placing items you use frequently at easily accessible heights, such as a countertop, so you don't have to bend or lean over to obtain them. Prepare ahead by making and freezing items to lighten the burden post-operatively. Be sure your pathways around your home are open and free of clutter to allow you to move about more easily and safely. Have family and friends lined up to be able to stay with you and assist you as you recover.
You will have hip precautions, which are guidelines. Do not move your knees higher than your hips. For example, sit in an elevated chair. Do not cross your legs. Do not turn your legs inward. Your doctor will tell you when you can stop following these precautions. Your therapist will help train you to manage steps and stairs. Do not attempt to take stairs the normal way with one foot on a step and the other above or below it. You will go up with your good unoperated leg first, then bring your operated leg up to that same step. The therapist will show you how to go downstairs in the same way, leading with your operated leg. Your therapist will put together a program for you to continue on your own in the hospital and at home. Talking to hip replacement patients from the OICM reinforces what we already know. Patients who follow their therapy instructions will be back to normal everyday activities and the sports and hobbies they enjoy more quickly than patients who do not. So plan to be active. You may bring a change of clothing. You may also bring your own assistive device to use, but we do have devices to loan to you while you stay in the hospital. We will help you get the equipment you need for home if you do not have any.
You will be using a sock aid to put on your elastic stockings as well as your regular stockings. You'll face the heel of your stocking to the floor and then begin to gently pull on your stocking onto the sock aid. Pull it all the way on. Once your stocking is fully on, take the ropes, drop your sock aid down to the floor, place your foot in the sock aid, and pull your handles evenly and slowly until the sock comes onto your foot. To get it up fully, you will then take your dressing stick, place it on the inside of your leg, reaching down to grasp your stocking. And bring it up to your knee where you can grab it without bending over, and then pull the stocking all the way up to your thigh. To remove it, you will push it down to your knee, grab your dressing stick, place it again down the inside of your leg. This will help you to prevent you from turning your leg inward, and keep working to push your stocking all the way off. To put on pants, shorts, or underwear, you will always put in your operated leg first. You'll take your reachers, grab the waistband, put your operated leg in first, then place your unoperated leg in. When you undress, do the opposite. You will take your operated leg out second. When putting on shoes, we will place elastic laces in your shoes so that you don't have to bend over to tie or untie. You will start the shoes over your foot with your reacher, keeping your knee lower than your hip. Then you will grab your dressing stick, which on the other end has your shoe horn. You'll place the shoe horn in and slowly slide your leg forward until your foot goes fully in. When you wish to remove your shoe, take your shoehorn, once again stick it on the inside of the leg, push forward.